brother?
What's good, man?
What's going on?
How you doing?
Good, good.
What are we doing today, man?
See, we're good day in the life. We're starting a little later today, but it's awesome. I already had a few meetings. Dude, I was just talking about buying a home care agency. I'm not sure. I had kind of a lawyer who does mergers and acquisitions, who's like a good family friend, who's been eyeing this like 10-year-old home care agency that he wants to buy. Looking for Dr. Gregory opinion.
Wow. That's crazy.
Yeah, insane, right? Kind of crazy, like when you start off, and just like own your time, you're able to like really start to explore new things. How you might begin, and where you land up can be different, but I'm always guided by this one principle. All I want to do is build care in the home. I was able to kind of catch up with one of our really good family friends. We were chatting about this company that he's been following. So this guy started a company in like 2011 and has grown this home care agency to like 3 locations in Massachusetts. They have all the licenses, tons of caregivers, just like the whole suite of services. But nobody's got doctors on their home care agency. Nobody's got Dr. Gregory products on their home care agency. Nobody's really thinking about what else is possible. We want to innovate, like putting, all types of equipment in their home. And I said, look, like you can buy it, let's just say it makes X. Can we double that business in a few years? Like, I love starting companies from scratch, but there is also a completely different model of buying something and having a foundation if you believe in it, and then taking it to the next level. And what would be interesting about this for me, which is why I'm so excited, is that we'd have a really great 10-year foundation. This guy started his company 10 years ago. Dude, we could just take it to the next level. It would be house calls every day. It would be Dr. Gregory products in the home, tablets, wheelchairs, walkers, like anything we can imagine, just to basically create that experience that I've really wanted to build. So stay tuned. We might be thinking about buying something in the near future and raising some money and doing something in the home care space. So for those of you in home care, watch out. Dr. Gregory's coming. We got the Dr. Gregory brand. These are the samples. Isn't this incredible? The first sample we ever made of a few of our products. This is our actual first pulse ox, but it wasn't the first sample. But this is the box, so we've kind of innovated a little bit, but it's such a small, cool, kind of matted finish. You can see the product available on Amazon soon. And the Dr. Gregory shop. Got the Dr. Gregory backpack for house calls. We designed everything. So like this is wipeable, super comfortable. Ready for house calls, man. Look at this. Ready to go. We got the doctor bag if you want it too, but I probably most of the time will roll with this thing. Looks awesome, huh? Dude, I think we gotta film this with the roadshow. The roadshow's coming. We're heading to Dr. Gold, who's a really great friend. He's a pioneer in a field of primary care called direct primary care. So basically it's a model that's built all about keeping that beautiful connection between patients and doctors. So we're gonna go head to his office. Before that, we're gonna stop at the pharmacy. I'm full service, so I have a patient of mine that needed a script. I'll talk to you about the pharmacy that we're stopping at. It's not Amazon, it's not CVS, it's not Walgreens, it's not Walmart. It's a small mom and pop pharmacy that was started a few years ago by a good friend of mine named Dimitri, who built a pharmacy in the community. They're not just sending a prescription, that's the easy part, but they're taking care of people, following their medications, and helping them, kind of live their best life. So let's go, we're heading out for the journey. We go pick up some meds for a patient of mine, full service. Oh my God, how's it going? How's it going? Good, good, how are you?
I'm really well, thank you very much. I heard some great things about you.
Oh, Dimitri's too kind. We've just like formed a relationship and like really love the work that they do. Simply taking care of people, that's it, right? Doing the right thing.
Before I forget.
Even I get my scripts at Bravo Pharmacy.
You see?
Huh?
Nah.
One thing I'm working on, I actually have Johnny who just moved from LA. Kind of our mission is to build, basically build care into the home. And kind of my day-to-day has been building hospitals in people's homes, but really kind of want to think more broadly, like, you know, I think there's a real model here to kind of build a scalable, you know, system, which I guess would include pharmacy, in-home care, clinical stuff. I'm launching kind of a medical product line in the home. And so Johnny's kind of following me, and like the goal is really to create like crazy amounts of content, you know, to build this approach and build the movement. Because I think that's what needs to happen. Like there's no question patients want it. You know, the only reason we're not changing it's like it's not enough direct to consumer and people aren't seeing what's available. So I just got to get there. And I'm willing to take, you know, take the risk to get there. I mean, it's an exciting time.
Where did you park here?
I'm just like across the way. So like I don't want them to tow my. Where are we, Johnny?
Right down there.
Dimitri, I'll be just like right back. Hopefully he's not giving me a ticket. I think we're good. This is just for fun, Dimitri, but check this out. DrGregory. Need my old school bag. Look at the pulse ox.
This is exactly what you were describing on the phone.
I'm not kidding.
Wow, this is wonderful.
So, these are my first samples, yeah. So this I just manufactured 3,000 of them. And then we're hitting Amazon, we're hitting the store. This is my house call bag. Look at this, you know, on the road.
Wait,
so I can make house calls.
You're kidding me. So this is actually...
I'm not kidding you. I'm manufactured out of China. So like kind of first sample, my weight scale. We're getting there.
That's awesome.
We're getting there. So we're at Dr. Jeffrey Gould's offices, super pumped. He's been a great friend, great mentor, and true pioneer in the direct primary care space, you know, which is a model of bringing back basic medicine. Let's go inside.
Unfortunately, I think our general public has not seen real primary care for decades.
Yep.
You know, they're not seeing what real primary care looks like. And especially in big area, you know, metropolitan areas like Boston, where they have the hubs of all the hospitals, is you need a specialist for everything in people's minds. And like the foot and ankle head at Mass General doesn't want to see an ankle sprain.
No, he does not.
He wants to see cases
that he's going to operate
that
on.
are complicated that he's going to operate on, he or she. We've got to get to the point where we start really focusing on showing people what real primary care looks like.
Yep.
And it's not just back pain, UTIs and coughs and strep throat. It's managing chronic disease.
Yep.
It's doing stitches. It's doing skin biopsies. It's doing joint injections. To me, it's a no-brainer. It's trying to convince the public that they need to detox from their addiction to the system that they keep going back to that isn't good for them financially. It's really not providing the best health. And this is not to say anything bad about the doctors. There's a lot of really good doctors in the system. It's a system that doesn't work.
Exactly.
They're doing the best they can. My hope and my mission is to not only provide this type of care for everybody from every walk of life, but also help my colleagues and rebuild primary care, you know, make it so that it's something that people want to go into. Healthcare is scary for people, and people get scared when they're sick or think they're sick, but we can actually like put some fun and some levity in it and make the experience a lot better.
You got to meet them where they are and kind of like get back to like the basics of just like, hey, we got you, man. You know, like I'm your special friend. I went to med school for a little while, like, let's get you better. We just finished up with Dr. Jeffrey Gould. He's heading out. Dude, we had an awesome session talking about, you know, his clinical model, the direct care that he's providing for his patients. So it's all about, you know, doctor and patient and really building that bridge and, you know, building a model that makes sense. So we had an awesome session with Jeff. We're gonna head back to Boston. Really excited to kind of share this experience. Like, this is the fun part of like, we weren't planning to be, who knew like the sunset would be so amazing. But yeah, man, we were talking about this earlier, like trying to figure out this process of like documenting my day in the life, right? Like, what does it mean? How do we make it interesting? How do we create content that's, number one, valuable, exciting, like that you want to watch, right? This is always like the thing, right? We're dealing with health. We're dealing with healthcare. Healthcare's freaking boring, right? How do we make that fun? How do we create like, you know, why the system matters and like why you need to care? Because once again, most people don't care about their health until they're sick. But that's the wrong approach, right? We're trying to get ahead of the curve. We're trying to like make sure people stay well and like actually understand why this matters. If you're watching the Dr. Gregory channel, give us feedback. We want to hear your thoughts. We want to create content that matters and really kind of connect with you in a way that like brings you value. So if you think of things that are meaningful, if you want to know more about anything in healthcare, right? Especially about home care, how to take care of yourself, how to stay healthy, let us know. That's what we're gonna produce. You're watching the Dr. Gregory channel. Much love. Thanks for watching. Stay healthy, stay well, and subscribe for more exciting content.